So I'm Liz Walshe. I'm a principal investigator in the Center for Injury Research and Prevention at Children's Hospital of Philadelphia, and also assistant professor of pediatrics in the department or at the University of Pennsylvania, starting this month. So my background has been in psychology and particularly in cognitive neuroscience for my PhD work. I've been working with CChIPS since 2018 when I was actually a postdoc between CHOP and Penn, and have stayed on and continued working. So CChIPS has been along with me along the way of finishing my training and then into my senior scientist position now. My research, really, my interests are on the young drivers, so teen drivers in particular, looking at teen driver crashes and interventions to prevent those crashes. And my areas of expertise are really in looking at cognitive development in these teens and neuropsychological assessment of those cognitive skills, neuroimaging, and simulated driving as well. And now starting to move into a space of kinematic driver monitoring technology as well. So as I mentioned, I lead the Neuroscience of Driving research program here, and the goal of this program is to really identify at-risk drivers with a particular focus on looking at the neural and the cognitive mechanisms underlying young driver error and crash risk. And so using some of these technologies like neuroimaging and cognitive assessment to detect higher level cognitive control during driving, to detect errors in or higher level cognitive errors in driving. And this is really driven by the statistics that young drivers are disproportionately involved in motor vehicle crashes. And there's really two things at play with these young drivers. There's, they're learning a new skill, which is very difficult. So there's a lack of experience. And then there's also the fact that they are still developing, particularly in the frontal lobe and these cognitive processes. So there's age, immaturity, and inexperience. So on the picture on the right at the top, you'll see one of our experimental paradigms that was really developed at CHOP and then brought to CChIPS to test with young drivers to particularly focus on teens. And so here we have MEG or magnetoencephalography neuroimaging, the helmet, paired with simulated driving using MEG or fMRI adaptable driving equipment like steering wheel and pedals, and then a simulated driving scenario and various scenarios that we've custom made to test basic driving skills and then increasingly complex cognitive demands on those driving skills to see what's going on in the brain of young drivers and how that's different to adults, and then also how that changes when we look at clinical populations who maybe have deficits in that frontal lobe processing area with executive functioning. And then a second area or another area has really been around driver assessment and also interventions and training. So my work has also established a validated virtual driving assessment that can predict crash risk. And so this is a 15-minute self-administered driving assessment. You can see it in the bottom picture on the right. It exposes drivers to common serious crash scenarios to really test their skills in high-risk scenarios, and then also can give automated feedback on skills that need to be improved. And we've used this assessment to predict crash risk in the first year of licensure using data from Ohio and an implementation there, and also predict how they're going to do on the road exam. This has now also been implemented at CHOP. So our primary care patients, our teen patients are getting this virtual driving assessment, and we're able to give them feedback on their skills and how they're going to perform. Secondary to that is to then follow up once we assess them, right? So I've done some work looking at how to inform or identify interventions for those who are at increased risk. So that could be technology, it could be training and education. And a lot of work to date has really established these methods, and a lot of this work has been done at the Children's Hospital of Philadelphia. We have a lot of other teens who may be high risk due to cognitive impairments due to a number of different diagnoses or treatments that might impact cognition. And then we want to think about how that plays into staying safe while driving too. So future directions are really to have individualized screening of crash risk in different populations, including different clinical populations, and to also tailor and target interventions to those who are most at risk.